we briefly spoke about erectile dysfunction. That the biggest thing for me personally has been my sexual dysfunction, which has come after the surgery. Going through different treatments to see if anything can help, and that again is quite an emotional journey, really, because obviously, as a man, being able to get an erection and hold that erection and have your intimate relationship with your partner if you've got one. It's quite an integral thing for a man to have. So, is there anything you can suggest, like to help that process? It wasn't only the fact that I wasn't able to get an erection anymore. It was the fact that I was having to go through all this different medication. There was injections. There was all sorts of stuff going on, pumps. There, all sorts of stuff. And it's, as I say, as a man, it's quite an integral thing. So it affects you in quite a deep way, I think.
Yeah, and I think again, it's something that's not always easy to talk about either. Like you say, especially if it's so integral to your identity as a man to be able to have and sustain an erection for intercourse and sex with your partner. To feel like that's been taken is quite a big knock. So again, it's the communication. You have your partner talking to them about your concerns you might have, and then afterwards, if there are any difficulties, how that might be impacting on you, because then does it affect your desire for
Yeah,
sex?
yeah,
Because when we think about intimacy and sex on a spectrum, there are so many other things that can be done. And I think um, when sex gets taken off the table, it can feel like, well, intimacy's gone. And it's like, well, it's not. So it's just that's why it's important to speak to your partner that, touching, kissing, holding hands, spending time together, all of these things are really important for intimacy as a whole, so that you don't feel like that area of your life has just gone out of your relationship completely. And when you think about the interventions that are used in order to help men to maintain an erection after surgery, obviously there's a bit of a time delay. So I think spontaneity in sex can be
yeah,
a bit harder to achieve.
yeah, yeah,
So if you've taken the time to speak to your partner about the concerns that you have, to work on that intimacy, then that can feel less intrusive for actually having sex, because you're spending time just being intimate, and you can sort of while away the time until things take effect,
yeah,
to with touching and kissing, and feeling like, well, actually we still have that sexual connection while we're waiting for things to happen in a different way.
yeah, yeah, definitely. Yeah, it's like you say, communication is such a massive thing with your mental health. It's it can be quite a difficult thing as well. For certainly for your staunch 50-year-old man who's been brought up in the 70s to
Yes,
come
yeah.
in contact with his emotions is quite a big thing, but it is so very very important.
No, I couldn't agree more. I mean, it's something that I do actually talk about a lot with men who I see and treat, that this so disadvantaged because you grow up being told, big boys don't cry,
Yeah,
be a big man. It's like, actually you really need to connect with these emotions and talk about them, because they're not going anywhere. They're
uh,
going to stay there.
right.
Um,
And
and
like I've said before, is when you bury stuff, you bury it and bury it and bury it, and then all of a sudden, there will be a point that will come to the surface,
yeah.
and it certainly did with me, along this path.
Yeah. And when you were talking before about sort of your body image and sort of your sense of self and sexual intimacy, when you've got all of that pressure going on internally as well, that's not going to be helping, because men need to feel psychologically well in order to have healthy, intimate relationships as well.
Yeah,
So the problems that come from post surgery aren't always purely physical; they can be psychological
yeah.
too.